So I'm super excited about the IRIS-CKD study, and the reason is, so you can say, well, you're a cardiologist. Why are you interested in a CKD study? And the reason is that the heart and the kidneys are like this, right? I mean, if the kidneys don't work well, the heart is not going to work well. So this is sort of for us, sort of a step back, that if you can help assess kidney function and treat these patients well, you can substantially improve the outcomes of heart failure patients who have heart failure. And if they don't have heart failure, you can literally reduce the risk or abolish the risk of developing heart failure. The problem now with chronic kidney disease is not that we don't have effective therapies. That was 20 years ago. We have done so many trials, and now we have a whole bunch of good therapies that can literally change the natural history and trajectory of disease for chronic kidney disease. The biggest problem is that we don't even diagnose these patients till it is very late. So by the time our nephrology colleagues get involved, the patients are looking at either impending dialysis or need for transplantation or recurrent hospitalization, but the process has started years in advance. So the question is that early part of chronic kidney disease, that diagnosis, is sort of in no man's land, right? I mean, it's not exactly a primary care problem today, not a cardiology problem today, not a nephrology problem today. And we need to take a step back and figure out how can we diagnose these patients in a timely manner so that we can implement effective therapy before they go so far down that now we're talking about transplant and dialysis. So that's what makes me very excited that the IRIS-CKD has one arm which is all about screening these patients, including in screening at home also, to make it much more patient-centric. And then once you do find out that somebody has chronic kidney disease, then to assess different ways of how we can implement therapies effectively in a shorter time frame than what it usually takes to get them on the right medications. So I think that the learnings will be tremendous, but also this will impact patients' life well in the future.